Good afternoon and welcome. So pleased that members of the media could join us this afternoon. On behalf of Substance Abuse Prevention and Recovery Coalition of Clinton County, also known as SPARCC, I'd like to welcome you all here today to learn about some very important issues and initiatives that are being done to address them. I'm joined by members of the SPARCC Steering Committee here this afternoon, and first going to defer to Peter Trout, who is the Chief of Services at Behavioral Health Services North, BHSN, and is also the chair of the SPARCC Coalition, to frame the issue in the larger context. Peter?
Good afternoon, everybody. Clinton County, like the rest of New York State and the country, is wrestling with how to combat the heroin and opioid epidemic. Locally, we know that lives are being ruined and families destroyed. Some examples. Between 2011 and 2014, Clinton County's opioid overdoses averaged 25% higher per 100,000 than the rest of New York State, excluding New York City. Between 2011 and 2015, Clinton County drug arrests increased over 18%. Approximately 50% of children placed in foster care by local social services are related to the heroin and opiate epidemic. Nearly 90% of county residents admitted to New York State inpatient substance use disorder treatment facilities between 2013 and 2015 had a primary or secondary diagnosis of opiate or heroin. In the fall of 2015, a small contingency from Clinton County traveled to Burlington for a New York-Vermont Heroin Summit. Our takeaway was that with the local expertise in the county and our long-standing history of collaborating across systems within the county, we felt that Clinton County could unite to address this epidemic. And so SPARCC, Substance Abuse Prevention and Recovery of Clinton County, was born. Unlike other community heroin opiate coalitions that have formed recently around the state, we chose a charge that is not solely focused on the heroin and opiates, but substance abuse issues at large. While heroin and opiates are now the top reason for admission into treatment, residents still actively use and abuse alcohol and marijuana. This is borne out with the local statistics that 10.7% of the county population has a chemical dependency problem, and 20.4% of the population report to binge drink, both alarming statistics that are above the state average. SPARCC, my colleagues here, this is the steering committee, is comprised of people in recovery, family members, concerned citizens, health and behavioral health treatment providers, elected officials, law enforcement, emergency services, employers, educators, media, religious organization, and community and civic groups. SPARCC has evolved into a dynamic group of individuals who are committed to reducing substance abuse throughout the county. SPARCC's mission is to foster community health through education, prevention, treatment, and recovery of substance abuse. Given that there is no single approach to alter the course of this devastating epidemic, SPARCC identified 4 areas to target in our 2017 action plan: prevention, intervention, treatment, and recovery. I'm going to briefly outline our action plans under each of these areas. For prevention, we identified a goal of conducting 2 community-wide educational events. The first one, coming up next week, will be discussed in more detail by Christine in a few minutes. Our second goal under prevention is to offer outreach and educational services to all county school administrators and educators. Under intervention, since syringe exchange programs have had a long documented record of reducing HIV transmission and promote harm reduction approach to entering treatment, SPARCC is promoting Project Exchange, a syringe exchange program operated by Alliance for Positive Health. As of the beginning of March of this year, Project Exchange has 259 individuals enrolled, 418,000 syringes have been dispensed, 384 syringes have been collected, plus another 12,000 from public kiosks. The program reports 111 Narcan reversals and 8 individuals engaged in treatment as a result of their efforts. Studies show that between 40 and 45% of prescription drug-using students indicated that they take drugs from a family member living in their home, and 14% indicate they took pills from someone not related to them. For these reasons, SPARCC is promoting the safe disposal of prescription drugs in the many area medication drop boxes. One of the greatest frustrations we've heard from families and individuals in recovery is that in a time of urgent need, they did not know where to go for help or who to reach out to. So we included in our annual strategy plan a plan to promote information regarding access to treatment and related services through our regional 211 information line, as well as a new resource guide that has been developed by the CEF library system. The resource guide will be available as a cell phone app next month. As many individuals with substance use disorders are ending up in county jail, we have identified a goal of reinstituting substance abuse assessments and education in the Clinton County Jail. Champlain Valley Family Center is partnering with the jail to bring this valuable service and make recommendations for ongoing treatment. The last goal under treatment is to deploy peer recovery coaches at the UVM CVPH emergency department at the County Department of Social Services. Peer recovery coaches are individuals with lived experience who have been trained to help others in need. Peer coaching is an evidence-based approach that helps people become and stay engaged in the recovery process and reduces the likelihood of relapse. Recovery is the last target area of our action plan. Recovery from substance use disorders is possible. Unfortunately, what most of the community hears are the number of arrests, the hospitalization, and tragically deaths due to substance abuse. Our goal here is to glamorize recovery and promote the many success stories that have taken place, and to show those in early stages of treatment that there is an alternative, hopeful life in the future. Woven throughout our action plan is the goal of eliminating stigma connected to individuals with substance use disorders. Addiction can happen to anyone, any family, at any time.
Thank you, Peter. And there will be an opportunity to ask Peter or any of the steering committee members questions at the end. Christine Peters is Director of Legal and Social Services at the Clinton County Department of Social Services, and will be the Master of Ceremonies at next week's event on Tuesday. Christine?
Thank you, and thank you everyone for being here. So our event next Tuesday will focus on a viewing of Chasing the Dragon, which is a film that's produced by the FBI and the DEA and also other governmental officials. But it basically focuses on the challenges and follows several individuals who are both addicted to heroin and opiates, and also kind of moving through the stages of recovery. So it really does get to the heart of this issue, and the issue that those individuals faced throughout their addiction, how they got addicted. It's very raw, it's very real, but we feel it's a good way to introduce this to the community so they can really see what this is about and how this epidemic can start. Because as Peter mentioned, it does start oftentimes from prescription drug abuse and not only from illicit drug abuse. And then it graduates later to heroin. So that's the feature, but that's certainly not the best part I feel of this event, which is to listen to the stories of people that are members of our community that have been personally affected by addiction and substance abuse. So we have 3 individuals that will be speaking after the movie, and one of them is named Jason, and he's an individual in recovery. He has over 2.5 years clean, and his story is riveting, and I think it's worth coming to hear what he has to say. The other two individuals that are speaking have unfortunately been sadly impacted by addiction. They have lost a family member, Amberlynn McConey, who was the sister of Stephen Cornell, and Francine Cornell, the mother of Stephen Cornell, will speak about their process and how they lost Stephen to a 15-year battle with substance abuse and addiction. And their story is important, and they really want to reach out and share so people can recognize the signs in their family members earlier, and they can help people to perhaps not go through what they had to go through. So they will be speaking specifically after the event. We've been fortunate enough to have Billy Jones be able to say a few words at the beginning of the event, and Senator Betty Little is sending someone as well to speak. So we will also have a panel of individuals who are in the community and have impacted or are impacted by substance abuse, including Michael Carpenter from the Northeast Group, Connie Wille from Champlain Valley Family Services, and Officer Chris Clark from the Plattsburgh City PD. And what we really hope is to just have people be really exposed to the reality of what this is, and to understand that there is still hope, even though this is tough. This is a difficult disease. It is a lifelong problem. It's not easy. Nobody has a magic pill, but we have to at least try to do something to educate, reduce stigma, and get out ahead of this. And if we can prevent individuals from getting addicted younger or getting help earlier, I think that's really what we're focusing on in this event.
Thank you, Christine. One note before I open it up to questions from all of you is to understand how pervasive this issue really is. The heroin and opioid epidemic that we face in our community and indeed across the country is very pervasive, and it crosses demographic lines, and it crosses socioeconomic lines, and as Christine said, it's not always related to illicit drug use, but can also be stemming from becoming addicted to prescribed medication. And it's very pervasive, and we don't always see the impact, for example, that it is having on the business community and employers and other facets of the community that you wouldn't expect to be impacted by this. So I wanted to point out that it's a very pervasive issue that we're facing.